To order, and I'll look for my clerk for attendance. Jen?
Thank you, Your Worship. Good morning, everyone. Welcome to the April 28th Council meeting. I'm Jennifer Connor, Clerk of Ramara Township. I'll begin with roll call of Council. Mayor Clark.
Present.
Deputy Mayor Bell.
Present.
Councillor Snutch.
Present.
Councillor Fisher. Present. Councillor Tuyu. Present. Councillor Goff.
Present.
Councillor Bell.
Present.
Thank you.
This meeting is being streamed live on the Township of Ramara YouTube channel. Be advised that by attending a public meeting of the Council of the Township of Ramara, you are consenting to your image, voice, and comments being recorded and will form a part of the public record. The chair, CAO, and/or clerk have the discretion and authority to terminate or interrupt the live streaming in exceptional circumstances where the content of debate is considered inappropriate to be published. Thank you.
Okay, first thing I have is the approval of the agenda, that the council agenda dated April 28th, 2025. Any additions there to be adopted as presented? Moved by Councillor Goff, second by Councillor Snutch. There will be a change in the order when we get in camera. Our lawyer's here today, but he's on Zoom meetings, off Zoom meetings. So as soon as he's available, we'll be moving the items that the lawyer's here for to the start of the agenda, probably right at the start of the agenda, depending on how time works out. So the order it's posted in may not be the order we're going at. So are there any other questions arising from the agenda? All in favor? That is carried. Thank you. Do I have a disclosure of pecuniary interest by any member of council? Not seeing any. If you find yourself in that situation later, please declare it at that time. So announcements. Well, the first one is I want to welcome our new Director of Infrastructure, Laura Pye is here. So welcome. You've taken the long road to get here from Severn to Aurelia to, where was it? Waterloo, I think, or Guelph you were?
Whitchurch Stouffville. So yes, thank you. I'm excited to be here and getting ready to work with everybody here.
Yeah. So how many days has it been now?
This is start of week 2. So,
Oh, okay.
yeah.
Well, yeah, you're an old hat now. So yeah.
Perfect.
Yeah. No more Mr. Nice Guy now, right? Well, welcome, Laura. We're looking forward to working with you. And again, thank you, Andrew. I think you're still here for another week, are you? Just handling the cleanup. Perfect. Do I have, before I get to the other announcements, today's election day, folks. Get out and vote. I still haven't made it, so we're going to adjourn early enough today that I can get there by 9:30 tonight. It doesn't matter what political party you are. Please take the time to vote. It does matter, and it is important. With that, who else has some announcements? Deputy Mayor.
Yep. Just got back this morning from Calgary. We had National Wrestling Championships. We have actually 4 kids medaled. We had 2 gold medalists. We had 2 bronze medalists. 2 of the kids were from Ramara. So we had my daughter placed 3rd. She got a bronze medal, and another girl, first time national champion. She won. She's also from Ramara, goes to Up to Grove. So very proud of those. We also took the under 15 championship home for the club. So pretty good day.
Awesome. Any other members been out and about? Councillor Bell.
Thank you. Yes. Last week we had the Ramara Chamber of Commerce job fair partnership with Rama Economic Development, and we were up at Rama Community Hall. Now I don't have all the numbers in quite yet, but I did have the opportunity to spend quite a bit of time there throughout the afternoon. And a ton of local services were there and available to help job seekers. Some different businesses were there. Of course, a little bit of an interruption with the ice storm and getting people organized to be there. So that was a little bit disappointing. But out of the gate, as soon as the fair opened up in the morning, there were about 35 folks who came through. So we'll have to stay tuned for some updates, but just overall a really great day.
Awesome. Yeah, even the ice storm didn't keep them away, so that's what we like to hear. Councillor Fisher.
Thank you. So our last meeting, I had suggested that our folks go out to the Legion for the Breakfast with the Easter Bunny. So that's now taken place. We had a bunch of kids out enjoying Breakfast with the Easter Bunny, and Zoo to You was there, and they got to touch and play with different amphibians and reptiles and creatures, spiders. There was a spider. So there was a spider. It's the only thing I didn't like. Everything else I was okay with. So that was a success.
Sounds like you weren't playing with the spider then. Yeah. Any other council members? Councillor Goff.
I'm just going to go off the thread that Councillor Fisher had said that everybody should read the article that's in Array of Matters regarding our Brecken Legion and the fundraising that they're trying to do in order to complete
The renovation.
renovation. So great read. And if you can support the Brecken Legion and their endeavors, that would be greatly appreciated.
Support the Brecken Legion. They were certainly there to support us during the ice storm where they opened as a warming center and they had a hot meal every day for anybody that didn't have hydro at home. So certainly get out and support our local Legion. Presentations. I have none, but public and special meetings of council, none, but I do have some deputations. Tony Fleming regarding the annual integrity commissioner report. Is Tony here online or? All right. All right, so we will put him on hold then, and we'll go with the folks that are here. Laura Webel Edgar, Dr. Kim McIntosh, Julian Fenech, and Executive Director on behalf of the Couchiching Health Team are here. So come on up to the front whenever you're ready.
Good morning, and thank you very much for having us. I'm Jillian Fenech. I'm the Executive Director of the Couchiching Ontario Health Team, and we're really happy to be presenting to you today around the OHT and some of our work that we're doing with primary care at the moment. So Ontario Health Team, so next slide. Perfect. The Ontario government is committed to connected healthcare and a centralized system of integrated care for social and health providers focused on patients, families, and caregivers. The changes that they're proposing and that we are working to instill within local communities is to integrate local services and strengthen them in the best interests of patients, families, and caregivers, making it easier for those individuals to navigate the system and transition between providers. So as all of you, I'm sure, have experienced at some point in time, some parts of the system are quite siloed, clunky, and difficult to manage back and forth between providers. And we really are looking out for the best interest of providers to make sure they have all the information they need to provide the best care and the best service, as well as patients to make sure that their process is as smooth as possible so that they're able to navigate as smoothly as possible. In the province of Ontario, there are 58 Ontario health teams. We are one of those. And so now every individual in Ontario is covered and represented within an Ontario health team. Last year, they chose to accelerate 12 of the 58. And the Couchiching Ontario Health Team was one of those chosen Ontario Health Teams because of the progress that had been made up until this point at moving some of that integration ahead and some of the historical pieces that were in place. The goal is to ensure that everyone has the benefit of a coordinated and integrated health and social service system. Under Ontario Health Teams, healthcare providers, which include hospitals, physicians, nurse practitioners, home and community care, and many more, work together to work on coordinated teams so that we are all working together to identify what those barriers are and opportunities for better integration. Next slide. This map represents who we are representing as the Couchiching Ontario Health Team. So Aurelia, Oro-Medonte, Severn, Chippewas of Ramara, and Ramara. They have attributed to us a specific population of approximately 67,000. So when we look at our goals, it is to ensure that those 67,000 individuals that they have determined who are attributed to us are receiving the best care in an integrated way. We view our geographical population as closer to 90 to 100,000. So we are really looking to implement that, even though they may be only measuring us on those 67,000. Next slide. We have a joint executive team represented by these organizations who make the decisions and who I report to. So we meet on a monthly basis to talk about what are those pressure points, how can we work together more collaboratively to move some of this work forward. So you'll see a number of hopefully organizations on this slide that you recognize from work that you also do with them. Next slide. We have a broader Couchiching Ontario Health Team family that is represented by over 30 organizations. So that come together through working groups and through specific initiatives to, again, move our initiatives forward and work collaboratively depending on what those topics of interest are, knowing that as we move forward for this next year, and we'll talk about that in some slides to come, the focus is on primary care. Much of the work and much of the health of individuals can be centered around primary care. So we may have broken it up in the past, and mental health may have sat over here, but mental health really can fit and is aligned with primary care, including home and community care, aligned quite closely with primary care. So a lot of our initiatives will just continue to build momentum as we focus on primary care initiatives going forward.
Hi there. Thanks so much for having us. I'm Dr. Kim McIntosh. I'm a family physician in Aurelia, and I serve as the primary care network physician lead. I also am currently serving as chief of staff at Aurelia Soldiers Memorial Hospital, but I am here today in a capacity involved in our Ontario Health Team. Feel badly speaking to people behind me. When you look at our broader OHT family, an Ontario Health Team is really everyone who lives, works, receives care in that geography. So municipalities are a really important contributor in all ways, social determinants, infrastructure, et cetera. So municipalities are, in theory, very much a part of an Ontario Health Team. So I just want to highlight that. And our geography historically was the old NSM LHIN. So when there were LHINs, there were 14 LHIN regions, local health integration networks. Those were dissolved, and 6 Ontario Health regions were created in the province of Ontario to try to streamline. Now, we're in Central region, which is massive. Mississauga to Huntsville, Midland, Penetang, Collingwood over to Markham. So in the context of a region, we have an Ontario Health Team, which is a much more known, manageable area in which we have known partners, and we anticipate having ongoing success in integrating care. So in terms of that success historically, dating back, and I've been around a long time now in this area. And when we were a sub-region, that was before 2019, we became an OHT in 2019, and then this pandemic happened. So I'll have the next slide, please. So many connections have occurred both when we were a sub-region altogether, Ramara, or Medonte, Severn, Aurelia. We've been a connected area for many, many years that predates our Ontario Health Team. But during pandemic, for example, there were so many opportunities to leverage those relationships. And I'll look to Tony because we certainly had spent some time together vaccinating across all of our providers at the Brecken Fire Hall, for example. And even pre-pandemic, there were relationships built where I would make a call to someone like Dr. Ricky Sheth, who was operating a clinic in Aurelia because he was net new. So I gave him a call. We chatted about his practice, his model, his vision. This was quite some time ago. But those are the kinds of things I did in outreach as the primary care lead, both in sub-region and then moving through pandemic to ensure everyone in our community had the opportunity, in the case of pandemic, to be vaccinated. And in fact, I drove around beautiful Ramara countryside to do in-home vaccinating with my team. We had over 100 COVAX enabled. That was the system we had to use in order to register a vaccine against COVID-19. So we had an entire group that supported our whole geography, and in particular, those who are hard to reach, those living outside of our main centers, and those particularly living in the countryside in Ramara. And I had some beautiful road trips and was welcomed into people's homes, and I was very grateful for that opportunity. And I've also made phone calls historically to the Good Doctors owner-operator, for example, when there was a clinic in Aurelia and a clinic in Brecken, to understand more about what does that service look like? What do those providers need for support? I spoke with the RPN who was working out here. This was a few years back. But just to give you a sense of the history and the work that's been underway, and maybe not always visible, but just in terms of how hard we all want to work as one larger community and an Ontario Health Team. And a lot of those relational touch points are why we've been successful and are accelerated as an Ontario Health Team. I'll take next slide, please. So the trick is putting that all into concepts that resonate with Ontario Health, that oversees the Ontario Health regions, that oversee the Ontario Health Teams. So we created locally this sense of, okay, that's all the providers connecting. What do the patients see? So it's really a continuum, right? Access, connection, attachment. And we're very focused on moving people through this continuum of care to such a point as we have enough family doctors in this community. We can't find the doctors fast enough. We can't train them, hire them fast enough. They don't exist. It's a national, international crisis. Okay, so we're pretty strategic locally. How do we maximize the skills of those we do have? We create teams. We advocate and are successful in garnering net new resources to expand primary care teams in this area. And we create connections. So we have an unattached clinic. We have a chronic disease hub. Yes, these things are geographically located in Aurelia, but the services are for everyone. And our next venture, as you'll hear, is about extending, when there is opportunity for any net new funding, is extending that opportunity to our borders, our geographic borders. So thinking about Coldwater and the docks there, do they have enough care for their patients in Severn? Ramara, do we have enough supports and resources? So expanding the teams and ensuring patients have access, connection. So we're connecting them through to the point that we may have an amazing team and support. And then family doctors will just naturally want to come and work and live here in all parts of our geography. So that's our sort of our patient facing way we think about how do we get folks into the system, because we can't just roster them all up to 30 new family doctors tomorrow. That's not feasible. So we create the teams, we address care needs and gaps, as Jillian mentioned. So next slide, please. So we have this dual purpose of creating connections amongst providers and creating connections amongst patients so they know where they can receive care. When it comes to our network of providers, we created a pandemic response table of several different types of primary care providers, and we formalized with the terms of reference in 2023 our leadership council, and we've had engagement sessions of family physicians, nurse practitioners, community paramedics, midwives, pharmacists, and Indigenous primary care providers who meet monthly, and we are developing and growing our primary care network. It's an informal construct. It's not incorporated, but it certainly has been amazing to develop relationships across all of those providers. And then that will reflect in where patients can get care. Because you need to keep, in order for docs to stay and want to work here, and nurse practitioners and midwives and all of our team members, you're going to have to feel connected and have people to help you, right? You need a team. Family medicine is absolutely a team sport, as is wrestling. So congratulations, that's exciting. I don't want to wrestle anyone in this community. But so as a team sport, we really are interested, and we're here today to share the work done to date and what opportunities there are moving forward. And we'll talk a little bit more about some of the services that we're growing for our patients. And, we do additional activities such as cancer screening for those who don't have a family doctor. Like we keep trying to take chunks of that whole primary care pie and piecing them together until we make a whole. And we also, our Ontario Health team does work naturally with our Aurelia Lake Country Recruitment Committee, because we need to grow these teams, bring learners and physicians into the fold to try to create our growing family and address increasing care needs that we all know are readily available in our communities.
Thanks, Kim. And with our work with the Aurelia Lake Country Recruitment Committee, it is not only about recruitment, it's also about retention, because we need a balanced system where we are not losing primary care physicians as fast as we can recruit them. It is a balance that doesn't help us in our goal to attach individuals. So we need to find some balance. Next slide. Just some examples of some local unattached. So you'll hear the word unattached a lot, and that whether it is provincially or locally, we are trying to adopt the term unattached, which really is anyone who doesn't have a primary nurse practitioner or family physician. So someone who feels like they're a little bit in limbo in how to access primary care services. And because we do not have a lot of walk-in services lately, or locally, they may feel a little bit lost in the system, which is why the unattached clinic was created, so that everyone in the community who feels like they're unattached has access to primary care and good continuous care if needed, so that they can be referred to some of the Couchiching Family Health Team services for some of those allied team providers. They have access to those now through the unattached clinic. As we continue to work on our recruitment, so we can eventually attach them, but that they do have access to care. So no one is without care within this community and within the Couchiching region. They all have access through the unattached clinic if they don't have a primary care provider to meet their needs. The other is the regional children's clinic that is operated by the Huronia Nurse Practitioner-led clinic. So they offer the children's clinic in 2 different locations within the Couchiching region, one in Orillia and one in Oro-Medonte. They are looking for opportunities for expansion if there's space available. So I'll just put that out there. They are always looking for an opportunity to partner and expand that clinic to other regions within their funded capacity. So it is a regional clinic, so people can access it from outside the Couchiching region, but we do prioritize our advertisement locally. Next slide. So I'm sure everyone's heard the name Dr. Jane Philpott. So it's certainly been mentioned a lot in the news, and she is certainly leading the primary care strategy for the province. And Ontario Health Teams, prior to the election, received a memo that indicated we had 2 primary tasks. One is to work on an attachment strategy for our region to ensure that everyone is attached to a primary care provider within 4 years. So we have some steep work ahead of us, as well as to attach everyone on the Healthcare Connect list as of January 1st of this year. So we are currently working on processes to establish that. 1.8 billion has been committed to enhance primary care teams to create a comprehensive, convenient and connected healthcare system. There is currently a process to submit some proposals. They were prioritized based on postal codes, and we were not one of them, which to us says, because we have our unattached clinic, we have a solution and we are not in as dire a state as some of the communities around us. But the one in September, so we know there will be another funding opportunity coming in September, will be open to all. And so that is what we're working on right now, is to look at some of those opportunities. And Kim started to mention some of those. How do we expand our Couchiching Family Health Team into some of the sub-regions by expanding our team for local access? And other opportunities, we're open to ideas. So working with our local primary care providers to determine what does that 4-year attachment strategy look like? What do we need to invest in? What proposals do we need to submit to expand that team, and work with the Orillia and Lake Country to be able to recruit new docs into the community? What are those pieces that we can work with our existing primary care to support those new individuals into our community, to create that network? And how do we get those new physicians into the community? Next slide. Part of our plan is also to have a truer understanding of how many people are truly unattached within the region and looking for primary care. The strategy of trying to attach everyone in the province to a primary care provider says everybody actually wants to be attached to a primary care provider, which is difficult to attach someone who is okay with periodic episodic care and not having a sole primary care provider. So we have launched our own local wait list separate from Healthcare Connect, as we're a little bit more flexible than Healthcare Connect is currently, to be able to get a better sense of how many people are without primary care, without a nurse practitioner and a physician within our region. And so that when we recruit those new docs, or the family medicine teaching unit opens, and they are able to roster 4 to 12 to 1,500 patients, we're able to provide them with a full practice off our list and say, here you go, you're ready to practice. And it's a combined list of patients. So I'm sure Kim could certainly speak to complexity and the range of patients that exist. And I'm sure all of you know, some may only see their doctor once a year, once every other. Others may see their doctor every week, every other week. And so to build a practice that is balanced, so it's healthy and for the primary care provider to be able to thrive, and also so that they can keep their interests up in various areas. So we want to build that practice with the primary care provider based on their needs and who's on the wait list. Next slide.
Good morning. I'm Lori Webb-Ledger, and I'm the primary care collaboration lead for the Couchiching OHT. So we're hopefully by now you are aware that we are here to really share the opportunities to connect with the OHT in order to be able to provide services and supports to the citizens that you serve here in Ramara. And I have left for you a lovely pile of resources so that you can share these in your community settings for the individuals in the community to be able to understand the services of the OHT. And I'm always happy to connect to continue that conversation to move forward together. There are lots of opportunities coming in the future for integration and support, working together, and really hoping to continue the conversation and dialogue to be able to make those connections as the work of the OHT moves forward in partnership with Ramara. So if you go to the next slide, please. So a big part of our work, as has already been mentioned, is building that primary care network. So there are lots of opportunities to connect providers across the system to build that cohesive and comprehensive team to be able to support the patients. And this is just an image, more affectionately known as our placemat, to help understand what are some of the things that we're hoping to be able to do together with all of the providers. So really, the primary care network helps individual providers have a voice and work collaboratively to be able to have input into the various elements of the work that we do together. So, for example, conversations about different information systems that are going to be more efficient and help connect patients better to services. So what makes sense to one group of providers or another, and how do we bring that together to open those doors? So there is lots of opportunity to connect, and thank you very much, Gail, for the connections and opportunities, and looking forward to moving forward together. So happy to take any questions if you want to go to the last slide, please.
Okay, thank you. Counselor Goff, I see your hand up already. Go ahead.
I don't know who to direct this to, but in your opportunities slide, it says soon to be Ramara FHO. What does that pertain to? And what is it?
So as you can imagine, if this were an easy business, we would all just have it sorted. There are many different types of models of how family physicians can come together and practice. So an FHO is a family health organization. So it is one type of model. We have two in Aurelia with about 18 and 24 physicians in each. The only reason we have two, we had early and late adopters. It's that simple. And both FOs are underneath the family health team. And there was a time where a family health team for allied services was specific to those rostered patients. But with our efforts as an OHT, we've expanded services such that all people who live in Ramara, Ormondonte, Severn, Aurelia can access allied services, right? We've already started to build the team out. So I would, thinking about Ramara, what could a collaborative physician model look like? And I think there are many possibilities. The trick will be the physician payment models and how they set up shop is really upon the individual providers. So how we approach it is we make some phone calls. Lori does a situational assessment. I might call if I see an ad in the paper, and I mean, there was a new doc who landed at a clinic, City Med in Aurelia. We saw he just got here from the UK 2 days ago and very quickly went, oh, wow, he's new. Does he know about the services and team here? And we sent out Melanie Delion from physician recruitment, and we sent out Lori from Primary Care Network, and they both met with Dr. Khalik to talk about, and he had little to no support in coming here to practice family medicine. So the models have to grow. They grow better out of the team concept because we really can't tell a doctor where to work or how to work. And there are some rules that sit with the OMA and Ministry of Health, right? The physician payment model is kind of over here. The nice thing locally and why we've been successful is we work around some of those absolutes. And we talk about building a team, connecting, how many docs are there, what resources do you need? What EMR, what electronic medical record are you on? Do you want to be on the one we all use so you can have some extra connections to resources? So we try to entice and build out teams. But a FO is a family health organization. It's a governance model. It has to have at least 3 physicians, family physicians, and they roster. And there are certain rules about after hours coverage. So a FO is one type of model. There are many, right? There are many ways family physicians can work and be paid. And that is really of their own purview with some rules around each. So that's a payment model, but I'm more into creating teams and then figuring out what works best. And then physicians will come with their own ideas potentially about a certain type of practice or payment model.
Supplementary, go ahead, Joe.
Yeah, I guess this is probably for Jillian. You mentioned briefly that you're trying to expand walking clinics to maybe Ramara. How can we sort of move that?
So that I might have been
Or-
misunderstood. So we're
Okay.
not actually trying to expand walk-in clinics. We are trying to expand our coordinated system. So walk-in clinics tend to be more fragmented, one-off episodic care. So that is not a model that we are fully invested in. It is more the expansion of the Couchiching Family Health Team, and how do we expand that team? How do we expand and recruit physicians into some of the supplementary communities to build a more integrated? Walk-in clinics really only create that one-off episodic care, and the goal that we've been tasked with is attachment. So it's not the walk-in clinic model.
Okay.
So are you sure?
Can I just add, when you see that's why we have access, connection, attachment for patients. We can't throw out our walk-in clinics. They are a place to get care, and we need them right now. So that's why I talk more of a collaborative effort. It's a continuum moving toward attachment, but we're not focused on building an episodic care walk-in clinic, but we have connection clinics, we have transition clinics, we have our unattached clinic. It is a type of walk-in clinic, but I just think that gets kind of attached to low quality, not keeping track of you, don't really care type of clinic, and that's not what we want to build. But is it important to have access as much as connection until we can get attachment? Absolutely. So I think that's why we try to bring in all the players, the good doctors, and like all these clinics that crop up in the physician's respective way of practicing. Make the phone calls, get the connections. Lori's talked to, physicians in different models. So we're really trying to build it. But so not about walk-in clinics per se, but definitely about access, connection, and attachment in a continuum.
So, and just the one other thing is the pediatric clinic. So the pediatric clinic might be where there is more episodic care for children, and that's where there is a potential for expansion with space.
So, I mean, we're hoping to create a flow here as well. Are you looking for locations as much as you are doctors? Like, we have a medical building, it's not very large. We have the two buildings beside us here that we haven't decided the fate of, and certainly want to sit down and have a discussion with you folks in the coming year of what to do with that building.
You've got space, we've got stuff.
Yeah, all right, good. And because we have to create something out of those buildings, and funding will be part of that ask, right?
For sure. And so, and I'm sure many have watched sort of the process in the city of Aurelia as well, where they were considering a medical clinic option. And so that is really where municipalities can help as well, both with space, because that is something that you have in your control for sure. And then some of those recruitment incentives to try and sweeten the pot for physicians to choose this practice, this community to practice, which is also what we're working on as well.
Okay. Deputy Mayor.
Great. Thank you very much. I guess my question is, how do we build a better partnership? Because I think for years we've kind of stepped out of that arena of the doctor recruitment, and we've been holding on to it. We actually put it aside this year. It's not that we're opposed to it. We just like to have a more clear business idea of what that gets us. Because I think the problem was we're hearing from our taxpayers that we keep giving money, but I still don't have a doctor. And it's frustrating. And so we were forced to start the good doctors to fill that gap. And I think our numbers, we'd share them with you if that would help, because that shows that is a need in this. It's definitely filled that. But us as a local municipality, we can't afford to fund healthcare. It's just too expensive, and it is taxing. So how do we get back to building that partnership where we can say we have this clinic, and it can be, even if it's 3 days a week, we have certain doctors that rotate through, some kind of a partnership we could build to help the people in America.
Look at the smiles.
I'm so excited. Sorry. You have me at space. I think, our next, so this is an excellent starting point. I think knowing that Ramara Council and Township is very much a part of our OHT, and that we have every intention to collaborate. We have, as mentioned, was PCAT, the Primary Care Action Team, which is this provincial government now has a full mandate for 4 years to try to, with Jane Philpott, Dr. Philpott leading, there will be a second, we weren't included in this first ask to garner more funds, but there will be a second ask. And I do envision looking at expanding in that ask for dollars toward primary care. It's not for doctors, but it can create an environment and a team that will bring doctors. There are also other opportunities once we create a team, if you have space, to bring in something like Practice Ready Ontario, where there are 3 doctors who come who are licensed but under a peripheral supervision, but can create. So there are huge opportunities that we've already really been reviewing with our recruitment group and with our colleagues. And I think we meet again. We include individuals who are interested, who have the mandate around health for this township, to join us in in putting forth the next proposal, I would say. To be fair, I had included in our proposal last year for expanded primary care dollars, I had included a concept of sort of the satellites of team in Severn and Ramara, and we got part of our ask, to be fair. So it was absolutely on the docket. I'm just going to, but if we can communicate and connect and talk about what that could look like. And now that's a collaborative ask, right? And then those are more successful when you have municipal, primary care, hospital, family health team all behind it. So yeah, exciting. So
yeah, thank you very much. That's that's very optimistic. And I mean, even I said, if we give the 20,000, is there some way that you can commit certain amount of patients from Ramara for the funding that we're putting forward for the next doctors to come in and say, and I know that you have to go with critical care. If somebody is actually in need because they have a disease or something, they have to come first. I get that. But there's got to be some way to at least show their taxpayers that we're trying to get them doctors, right?
100%. So, and I was just going to reiterate that this is the beginning. This was our hope in coming to present to you today, that we could start that relationship again and renew that. Because of the investment the city of Aurelia is making as well, they're asking the same thing, right? How do you show evidence of our investment? So 100%, the Aurelia and Lake Country physician recruitment is clearly orchestrating a plan that will, even though when they approach physicians, they're giving them all options. They are not targeting them any which way, but some of the recruitment incentives may be targeted specific ways. So that is something that certainly we can look at. The wait list, we can certainly provide numbers as we start to attach people. And we all want to work together. So looking at all of those options, how do we work together to maximize on opportunities? And Recruitment Ready Ontario is only available to this community and Severn. So that is an incentive that you have that their city of Aurelia doesn't have. And so how do we put that all together in a package? So when Melanie goes to these recruitment events and is trying to get physicians back from the States, because many are wanting to come back now, and the UK, that they are saying, hey, look at these beautiful communities that have all of this to offer. And there's lots of physicians who want better balance in life. That's why they don't want to work in the city. They want to work in a more remote, balanced life environment. So this is the start. This is really where we want to work on that. And also, just to reiterate, we know the next funding cycle will be in September, but we anticipate there being multiple opportunities over the next 4 years. So we can build a plan that is staged so that, we start somewhere. It might not be where we end up in 4 years, but we continue to work together to achieve our goals.
the other bit of secret sauce is retention. So you may get them here, but if it's just a return of service or shiny something or other communities have trialed that. And unfortunately, we're all competing. We're stealing from Peter to pay Paul. But retention is where the OHT and our primary care network can really come into play, this placemat, these opportunities. So we build that into all future proposals. So not only do we recruit, but we retain.
Yeah. We're actually known for that at Ramara. We get the folks here, they like to stay. So,
Gotta get them here.
any other questions? Councillor Bell.
Thank you, Mayor. Actually, just a comment. I actually think I met you, Kim, Dr. McIntosh, at a conference, and I'm not 100% sure, but I think so. Jillian, I don't think we've met. And Lori, I did have an opportunity to speak with you, and I just wanted to chime in quickly and say thank you very much for bringing a deputation and helping to educate a little bit about, what the Ontario Health Team offers. I appreciate it, and I really appreciate a fresh new beginning and collaborative partnership. So I wanted to have the chance to say hello since I'm not in the room. So thank you.
Yeah, Councillor Tuyu.
Thanks. I'm really excited to see you here. I remember we had a conversation about this exact thing a couple of years ago when I was in. Full disclosure, Dr. McIntosh is my doctor. and I really feel, given that we know the Ministry of Health certainly wants us to go more in the direction of the Ontario Health Team type direction. It just makes sense. I have full confidence, especially with you, not only as Chief of Staff, and I congratulated you before, but I think it bears repeating on your King's Coronation Medal that you recently received for your service. It's very prestigious and very well deserved. So I'm really looking forward to the collaboration.
Yeah.
I carry tissues. That's what
No, good.
Hard on sleeve.
Yeah. No, it's interesting. When I met with Minister Jones, they spoke very highly of the Kuchiching Health Team. So no, you've been noticed. So now let's take it and run with it, right? Any other questions from council? Not seeing any. Madam Clerk, do you have a motion for me?
Thank you, Your Worship. The deputation by Lori Webble Edgar, Dr. Kim McIntosh, Jillian Fennick, Executive Director, regarding an overview of the Kuchiching Ontario Health Team, the primary care networks, and supports available to the residents of the Township of Ramara be received as information.
Moved by Councillor Goff,
Can we-
second.
Can we make an amendment?
You want amendment?
Yeah.
Yeah, two
I-
amendments
yeah.
possibly here.
Well, I think.
I think it's the same one. I think
Right,
we're
we
just
want that
to look,
staff to move forward.
to move forward, yeah.
Yeah.
100% do a report.
Do a report, move forward for a report. Yes. Moved by Councillor Goff, second by the Deputy Mayor. All in favor? Thank you for joining us today. That is carried. So maybe a message to Colton in the back. Do I have Tony Fleming here? Okay, perfect. So I'll go to my first deputies. Thank you very much. Morning, Tony. So whenever you're ready, sir.
Thank you, Worship, and through you. So, Council, you will have the annual report. I understand that you should have received that some time ago. Really, the report, Your Worship, speaks for itself. Unfortunately, with respect to sort of the next phase of what the Integrity Commissioner regime looks like in Ontario, I don't have much to report. I can advise Council that I'm a member of Municipal Integrity Commissioners Ontario, which is an informal group of integrity commissioners. We met a couple of weeks ago. We are going to be making additional submissions to the ministry on the proposal, but we don't even, for example, have a draft of what a regulation might look like, for example, for what the province might be imposing upon municipalities with respect to new codes of conduct. So I can't really even tell council what that might look like, but I am certainly happy to take questions from council either on the report or if you have specific questions about what the province might be thinking about for the Integrity Commissioner regime.
Yeah, it's hard to say where the province is going on that one. I was shocked to hear that there's municipalities don't even have a code of conduct yet. And I think that's why they felt like they have to step in on, because it's been mandatory for years. But
it's been mandatory since 2019.
Yeah, we actually had it before then. We had it, CEO Richard Bates had us a code of conduct shortly after I first got elected in 2000. So yeah, it's, we've had it quite a while. Any questions from council members? Not seeing any. So thank you for the annual report. That's a quick and easy one, sir.
I like it. Thank you.
Do you have a motion for me, Jen?
Your Worship, we'll be doing the motions for all the council agenda at the end of the meeting under the new format.
Oh, all right. You don't do one to receive when they're here, though, the
No,
deputies?
we'll do it at the end of the meeting.
Okay, that's fine. Perfect. There you go. So thank you for your deputation, sir.
Thank you, Your Worship.
Okay, with that, I did have a request for a quick bio break. So if we can just 5 minutes and then come back after the deputations, we'll get back to our agenda. Okay, we are live again, folks. Oh, you got something for me? So now I have the open public forum. Now normally you'd register at 9 a.m. if anybody in the crowd wanted to speak for 1 minute each on anything on the agenda. It's a new format, so I'll look for a show of hands. Does anybody want to not seeing any in the future? We'll as we get through it, I'll make sure I ask folks when they first show up if they want to speak so they can get registered. So I don't see any hands. So now we're on to the council minutes. Madam Clerk.
That the council meeting minutes dated March 24th, 2025 be adopted as presented.
Moved by the deputy mayor, second by Councillor Tuyu. Questions arising from the minutes? Not seeing any. All in favor? That is carried. Council meeting minutes, April 14th. Madam
That the
Clerk.
council meeting minutes dated April 14th, 2025 be adopted as presented.
Okay, again, moved by Councillor Fisher, second by Councillor. Oh, okay, Councillor Snutch. Any questions arising from the minutes? Not seeing any. All in favor? That is carried. And lastly,
That the closed session minutes dated March 24th, 2025 be adopted as presented.
moved by Councillor Goff, second by Councillor Tuyu. Questions arising from those minutes? I guess we'd have to go in camera if another. Not seeing any, so all in favor? That is carried. Okay, now we reconvene into our committee of the whole. Madam Clerk.
That pursuant to section 239(4) of the Municipal Act 2001, notice is hereby given that the committee of the whole intends to hold a closed session meeting in the Richard P. Bates Room to deal with matters pursuant to section 239(2) of the Act.
Okay, so I'll look for a mover for that. The deputy mayor, second by Councillor Fisher. All in favor? That is carried. So to the folks here, we're a committee of the whole, but we're also going into the closed session. So we'll go into the other room and then we'll be back for the remainder here, hopefully shortly. Okay, got my mic, so I will go back to our clerk for roll call now that we are rising to report.
Thank you, Your Worship. I can confirm that we have quorum.
Thank you. Now, did you want to do the in camera later or do it now?
We'll do it now, Your Worship.
All right, we'll do it, but we're still in committee of the whole, so it's just a matter of ratifying what we did and then later at council, correct?
Yes.
So go ahead, Madam Clerk.
That we appoint Judy Mitchell to the Ramara Trails Committee for the remainder of the term ending November 16th, 2026.
Okay, moved by the deputy mayor, second by Councillor Tuyu. All in favor? That is carried.
The Councillor Bell be removed as the council-appointed representative to the Lagoon City Parks and Waterways Commission effective immediately, and that Mayor Clark be appointed to serve as council's representative to the Lagoon City Parks and Waterways Commission for the remainder of the term, and that Councillor Bell be removed as Chair of Protective Services, and that Deputy Mayor Bell be appointed as Liaison of Protective Services.
So do I have a mover and a seconder for that? Moved by Councillor Tuyu, second by Councillor Schnutch. All in favor? Opposed of any? One opposed? Yeah, recorded vote will come at council later. Go ahead, Councillor.
Yeah, no, I was doing the opposed. Thank you.
Yes, one opposed. Thank you. And I think we have two more.
Yes, Your Worship, that the correspondence regarding OLT-24000931 OLT case name 1000239-297 Ontario Inc. versus Ramara be received as information.
Moved by Councillor Fisher, second by Councillor Goff. All in favor? That is carried. And lastly,
That the correspondence regarding the appeal of costs award March 20th, 25, and the Township of Ramara Director of Legislative Services memo regarding Lagoon City Parks and Waterways Commission shore wall costing response be received, and that staff be proceed as directed.
okay, moved by Councillor Fisher, second by the deputy mayor. All in favor? That is carried. So that's the last one. So reports, council reports, we have none, and board and committee reports, we have none. Council referral reports, none. Department reports. So I do have one here. If you want to read us a motion, Madam Clerk, and we'll go from that.
That the 2025 Recreation Master Plan and Ramara Recreation Plan presentation be received as information, and that we adopt the 2025 Recreation Master Plan as presented.
Okay, and I'll put it on the floor. Councillor Goff, second by the deputy mayor, and I believe we have a presentation. Come on up whenever you're ready.
Good morning, everyone.
Morning.
Can you hear me okay with this? Yeah. Okay.
So you're not Ryan, you're Debbie?
I am. Ryan is here though.
Oh, okay. All right.
Yes. Yes, we're up. So as you said, good morning, everybody. And nice to meet all of the staff that I have not met, some new faces here. So my name is Debbie Vandenacker. I am a senior planner with Planscape, and this is Ryan Lloyd behind me. He is a planner at Planscape as well. And we were the team that took on your recreation master plan for you. I just want to take you through a little bit about what we heard since the last time that we spoke with you at our last round of consultation that you had asked us to do, and then present the final product to you. Next slide, please. So I like to always go back to the original purpose of the master plan that was put in the RFP for us, and that was to create an impactful recreation master plan and to serve as a strategic blueprint. And then you were also very specific about doing short, medium, and long-term priorities and goals, which we absolutely agree with doing. So we have made sure that that was a priority in the final product. Next slide, please. So a master recreation plan identifies local community needs and offers specific recommendations. We have attempted to do that wherever we could, where there was more information needed or where there was a moving part. We have identified that and typically recommended in the medium or the long term. This plan was developed through public, resident, community groups, staff, and council consultation and engagement. So you may remember the discussions that we had in the additional consultation that took place. The plan focuses on the tangible short-term action. So what we know with the recreation master plan in rural areas with not unlimited budgets, as nobody has, is that the short-term tangibles help to create momentum. And so we have tried to do that wherever we possibly could. And then medium and long-term priorities are discussed and identified as well as recognized as subject to change in demographics and all of the moving parts of society. So we've tried to identify what you can do now and what you should continue to do to build the momentum, and then identify the medium and the long-term priorities from all of the consultation and the research that we did, recognizing that those will change and evolve as you get to them. Next, please. So the plan review and update began in June of 2024. We had the multifaceted public stakeholder engagement sessions. We had sessions with council. We actually added a session with senior staff where we did a half-day workshop. It was really helpful. A township-wide site tour was conducted. Ryan actually went out a couple different times with staff and with the one of the committees. Thank you, the Accessibility Committee. I just couldn't remember the word, to view a bunch of the different facilities. And then the findings were refined into our recommendations. Next, please. So what we heard through our consultation from council was that there was concerns with the limited community feedback. I hope we have addressed that. There was quite a bit of effort actually with your staff as well to go through and just see, when you do online surveys, those types of things, how many comments you typically receive back. And so actually what the 284, I believe, that you got is actually a pretty good marker. And so it's one of the things that we recommend you continue to do with your communications department on a regular basis as you either bring on projects or as you have a question about what to do next with your recreation, that you continue to do that process. You wanted more engagement and opportunity for public input. We provided that through that second round of engagement. There are, just to recognize that there are financial constraints and the impacts of those constraints. We've again tried to recognize that as well, and that resident priorities should be driving this. So at the open house, the public feedback that we received was that one of the key differences was the importance of motorized recreational opportunities in the township and the need for connectivity, trails, and spaces. So we understood the trails pieces before this last round of engagement. But we had some really good conversations with sort of like the ATV, TV, Snowmobile Club folks. And so we've made some more specific recommendations from that. St. Andrews Hall and the Standard Bank redevelopment is preliminary with just a staff level concept, and so no known support yet for any sort of concept for residents or council, and it does have high financial implications. So we originally thought that would be more of a medium term priority, but we have moved that to more longer term, just given the implications of it. Next, please. So the public feedback to continue with their input into that process was that we need age access and ability friendly programming. So they wanted more than just sports for your residents. The importance of community partnerships, the community gardens were mentioned in the kitchens, and then facilities investment and maintenance. So they wanted to make sure that any and all partnerships with all of your existing groups, all of those types of things are considered. And then Brecken community needs indoor recreation programming space was something that we heard. Next, please. The parks and trails improvements were brought up, safety and access, and making sure that the parks are, what you have are well maintained, and making sure that they're safe for residents to use now, and that local school area improvements as well. So investigating safe pedestrian and cycling trails and lanes. Next, please. So all of that consultation plus the process that led up to that final round of consultation led us to the roadmap kept coming up in conversation. So we just went with it and we created the visual for this. So these are your short-term priorities that we have recognized in this roadmap. Excuse me. So these are the things in the 1 to 2 year scenario that staff would keep working at, that these were the things that you direct your resources and your finances towards to try and create the momentum for the medium and the long term. So communication was one. We all know in today's digital age that reaching out to your residents and having a way for them to book or to see new programming and to see advances is really important. So we recommended that a multi-use recreation communication product be created. So one of the reasons that we went with this imagery is that we know something that reminds people, something you can print out, something you can tack on your fridge. I do this all the time from the Bracebridge Sports Complex that we do. They do a really good job of printing out quarterly calendars. And so you can pick them up and they get tacked on my fridge, and then everybody knows when swimming is this week, those types of things. So those kind of products that work for your residents, and this may be a really good way to use that survey to see how people are using that. But that communication piece is really important. The building relationships, again, with the rural capacity and the budget capacities, it's really, really important to build the relationships with not only your First Nations partners, but with your other municipal partners. Programming improvements, parks, trails, the Breckin Community Center to plan and finalize redevelopment, and then the operational review that is currently underway. So the operational review will give you that confidence that all of your resources are being used as effectively as they can to achieve your priorities. Next, please. So the medium term, the 3 to 5 year, I don't need to read these unless, no, I'm sure you don't need me to. These are the ones that you continue with your 1 to 2, but these are the ones that you can pull into the 1 or 2 year time horizons to start working on them to make sure that that is the priority that you want to make your next short-term priority. And there is a list of them. And these, again, came from all of the conversations that we had, lots of input from your staff. And so this is something that when you're doing your budgeting, it needs to be considered, obviously, but isn't your, this year and next year's budget. Next, please. And then the long-term recommendations. So these are your 5 to 10 year out. These things, again, are what we know now. It's not going to obviously account for the changes that are going to happen in the next few years. So this is recommended that it be reevaluated, obviously, before anybody gets into investment. But it is good to keep your eye on the long-term ball. And so we wanted to make sure that those were available as well. Next, please. So the final product, in your 2012 master plan, the one you currently operate under, you have a checklist of many, many items. And we went through the exercise of doing this in the final report that we checked. We went through with your staff and said, okay, where are you with each of these items? We checked them off, noted that it's in the report itself if you wanted to check that. But it seemed to work really well as something to go back to. Your staff can go back and refer, see how well we're doing, what do we need to do next? And so we put this in a checklist format as well. So what we did in the final report itself is the executive summary contains this, and then next slide, please. And this. So on an 11:17 format, you can print this out. It can be on the wall. It can be the checklist on your desk. You can use it in a variety of ways. What we were trying to give you is that product that carries you forward, because nobody wants to have a report that just sits on the shelf and nobody can reference. So that's the intent of these lists. So it basically lists all of your short-term, medium, and your long-term priorities for your recreation master plan. Next, please. We also wanted to give some input and some guidance on execution priorities. And so this is a really simple checklist. I use this all the time, especially when I was in the municipal world. I used to call it a go, no-go checklist, even in the engineering world. So when a project comes forward, just having a template that you can say yes, no, and you just fill out the basics. If it meets the parameters as a pass, then you can move it to the next step. And then you've got documentation of what you had considered, why it moved forward, why it didn't. And then we have the 8 short-term recommendations in that final piece. So next slide, please. That essentially sums up the final rec plan and the and how we laid it out for you, hopefully to be the most useful that it can be for you and to move you forward. And so thank you for allowing us to participate in this process with you. It's been enjoyable. We hope it serves you well, and I'm happy to answer any questions.
Okay, I'll open it up to the floor. Any questions at this point? Well done. Thank you. Councillor Snutch. I see you too, and then I'll go to Councillor Bell. Councillor Snutch first.
Yeah, I think it's great. My concern is with what we're supposed to do here. It says in that we adopt the recreation plan. I think we should be receiving as information, because I think there's a lot of stuff we have to decide. Are trails before pickleball courts, or pickleball courts before indoor facilities? So it's just the wording, because I don't know what we're really adopting. It's a great reference, but maybe that goes back to staff, and then staff says, these are the things we're working on. And then we basically give approval to that. But without numbers and dollars, I don't think we should be adapting the plan.
I think it's a living document. And again, every budget is when you'll sit down and look at what you go back to the plan. Okay, these are your priorities. And again, we have limited resources. So that would be a pick and choose at that time, I would assume. But Debbie, can you answer that concern at all?
Sure. Thank you. Through you. It's a great question. The adoption of the plan is to give your staff direction on what to work on next, not the projects themselves. So when you allocate money, same process as you typically go
I
through.
just don't know if I want them working on pickleball courts or trails. I haven't sort of made the priority. So I don't really want this to be a guideline unless it comes back to council and we specifically state what we want them to work on. This is a huge plan. You could spend hundreds of thousands of dollars adapting this plan, and then basically it comes to council and everything gets shot down. So I would like to see something that gives me very specifics about what staff is going to do in the next year. That helps us drive this plan forward. Nothing wrong with the plan. I just think everybody would want to be more involved with the details of what we spend our resources on.
CEO Jackson.
Thank you, Worship. And certainly language that is quite possible is to simply either receive the report, adopt in principle, which then sort of gives just that sort of perception of, you know, we've got the document, we understand the document. It is incumbent upon staff, if we are going to be working on specific areas within that document, that we come back to council and we talk to council about what that project plan looks like. So that will be part of the overall process. So if the wording as you see it right now, adopt, causes concern, then certainly that could be amended to receive the master plan or adopt in principle as options for consideration. But just to be clear, Mr. Mayor, is that when staff move forward with some of these initiatives, it will be done in consultation with council.
Yeah, I think you adopt it in principle on the plans there. And then like you say, if all of a sudden we're getting more demand for pickleball, then that has to come to us for discussion. It's in your plan. It's a priority to the people, but we still have to make the financial decision whether to go into that realm. Councillor Bell.
Thank you. My concern, I guess, is quite similar to Councillor Snutch's, only I would take it up a notch. And what I was hoping for and what I've been hoping for all along is that we would be able to create a committee representative of each of our communities, so that you would have, Longford, Lagoon City, Bayshore, whatever at the table together, a representative. And then together that group could talk about priorities and help to identify where do we have gaps and what is most important, what should happen first, because I think it's really hard for just the people sitting around the council table to have a good sense of what we have. A big picture look right now, but in a more granular way, we don't really know what does each community want. So, for example, Atherley was able to put in there the pickleball court. So if a pickleball court is coming somewhere, then it probably should be somewhere in a community that doesn't have something already. And I think the best way for us to do that would be to just take this up a notch and say, yes, we in principle receive the plan, but that the formation of a representational committee is formed so that we have the opportunity to make sure our communities are truly engaging with each other and working together on how they want Ramara to look from a recreation perspective.
Anybody want to comment on that?
I'll just go. I'm not opposed in principle to what Councillor Bell is saying. My only concern is to slow it down. Every step we put in it's going to slow every bit down, and there'll be a lot more controversy. I think we've gone out and we've spoke to everybody. We did public consultations to get this information already. So I think now it's taking that information we've gotten from the public, have staff, they now have direction as to what our residents want, and start to implement those things as long as we can afford it, as long as it makes sense budget-wise. Does that kind of wrap it up?
Literally going to always come down to budget. That's
yeah.
Go ahead. And if I could just add, it's the plan is, we know from all of the consultation and from all the discussions that we've had what the short-term priorities are from your residents. So we don't see it as a prioritized list. We see it as an opportunity list. So when an opportunity is available, when a partnership becomes available, you refer to the plan and it says, yes, this is on our short-term plan. It's it's really how to green light something going forward. So it's not really to say that trails are more important than pickleball or anything else. We understand that maybe not all of them can get done, and it's really based on the opportunity that comes forward.
Counselor Tuyu, I think I saw your hand earlier.
Yes, thank you. One of them was asked and answered about it being a living document, but one thing that's sort of come up in one of the individual community boards that I'm part of is that since the ice storm, maybe the priorities have somewhat changed and people are maybe looking at more of the, maybe we do need these, smaller community centers down the road rather than, merging, eventually moving towards something big. Because just their value alone is some kind of warming center or something. I had residents mentioning, what if we get a generator in this community center local to us, walkable, and then that could function in that regard as well as still be an active community center. So that's just what I wanted to share on that.
Questions or comments? Looking around, not seeing any. I believe I had a mover and a seconder. All right, so I think we're going to amend the motion to approve in principle, I think is what the amendment was going to be. And is that fine with my mover and seconder? I'm looking for knowledge. Yes, it is.
Yes.
Adopt in principle, yes. Okay, all in favor? Opposed of any? No, it's carried. Thank you. Yes, Councillor Bell.
Thank you. Part of the reason I stayed home today was I was hoping to get a last minute appointment. My eyes are bothering me today, hence the sunglasses. And while we've been in, I have been awarded an appointment. So I'm afraid I'm going to have to leave so that I can make sure I get there. And I didn't want to just run out of the room without letting you know why I'm disappointed.
Okay. Thank you and good luck.
Thank you very much.
All right. So we're going to lose a councillor. So I've got the annual water reports, I think, are what I have on my agenda next. So give a motion for me, Madam Clerk.
That report ID 1525 regarding the completion of the annual wastewater performance report for the Brecken Lagoon City wastewater system and the Bayshore Village wastewater system be received as information.
Okay, moved by Councillor Goff, second by the Deputy Mayor. Questions or comments? We've got both directors here, so. Councillor Goff.
I think I received a email last couple of days from a resident questioning some of the proponents and numbers on Bayshore spraying and effluent. I don't know if you can elaborate on them. Questions that were asked.
Andrew?
Through you, your worship, I believe today we're just bringing forth the annual reports. Ultimately, I can respond, or our new director Pi can respond on those comments. That wasn't part of the agenda as today's package. So we do have Mr. LaRue and Ms. Lorente here to answer operational questions if you wish on those wastewater reports. So we'd be happy to do that if you so desire.
So any other questions on the report? So all in favor, receiving? That is carried. I had a mover and a seconder, I believe, did I not, Madam Clerk?
Yes, your worship.
So now we have the drinking water annual reports.
The report ID 0825 regarding completion of the 2024 annual drinking water reports be received as information.
Moved by Councillor Tuyu, second by Councillor Fisher. Good score across the board there when I was looking at them. Any questions or comments on those? Not seeing any. All in favor? That is carried. Thank you. They're very detailed reports, so it's all in there, right? So next I have the soccer club.
The council approve the operation of a food vendor on municipal property during approved rentals for the Ramara Soccer Club games and events from May 31st to August 16th, 2025, subject to the vendor meeting all licensing provisions of the township's business licensing bylaw 22038 for refreshment vehicles.
Moved by Councillor Fisher, second by Councillor Goff. I think we've had vendors there before years ago, didn't we?
That's correct,
And it kind of went by the wayside, so nothing new here. Deputy Mayor.
Just a quick question. One of the things I've noticed with vendors when they come in, they often do produce more garbage and things like that. What is the plan for that? Are they responsible for taking whatever is produced there, or?
John.
Thank you through your worship, Deputy Mayor Bell. They'll be required to provide a site plan where everything's going to be located and garbage and removal will be a condition of their license.
Counselor Fisher.
Thank you. When I was looking at the suggested motion, the recommendations from staff, like it's pretty exciting actually to create some excitement for recreation in Ramara, to have something like this available. I was just curious because the soccer club operates for a relatively short period of time, just in the summertime, and only, I think I said on Saturdays. So is this going to be a food vendor that has a trailer coming back and forth, or is it going to be placed on our property for the duration and only opened on those days?
John.
Thank you to the mayor. This will be only operational during the soccer rentals, and it'll be a cart that comes and goes.
Any other questions? Be straightforward. All in favor? That is carried. Not seen any opposed. So next I have, I have the next motion, Madam Clerk, if you want to read the Rural Road Safety Initiative.
Thank you, Your Worship. The report ID 1625 be received, and that we support the Rural Road Safety Program developed by Ontario Good Roads Association. And whereas official statistics from the Government of Ontario confirm that rural roads are inherently more dangerous than other roads. And whereas despite only having 17% of the population, 55% of the road fatalities occur on rural roads. And whereas rural, northern, and remote municipalities are fiscally strained by maintaining extensive road networks on a smaller tax base. And whereas preventing crashes reduces the burden on Ontario's already rural strained healthcare system. And whereas roadway collisions and associated lawsuits are significant factors in runway municipal insurance premiums, preventing crashes can be a significant impact in improving municipal risk profiles. Therefore, be it resolved that the Township of Ramara requests that the Government of Ontario takes action to implement the Rural Road Safety Program that Good Roads has committed to lead. It will allow Ontario's rural municipalities to make the critical investments needed to reduce the high number of people being killed and seriously injured on Ontario's rural roads. And further, that a copy of this resolution be forwarded to Premier Doug Ford, Honorable Prambit Sakaria, Minister of Transportation, Honorable Kinga Suma, Minister of Infrastructure, Honorable Trevor Jones, Minister of Agricultural, Honorable Lisa Thompson, Minister of Rural Affairs, Honorable Jill Dunlop, Minister of Emergency Preparedness and Response, Honorable Sylvia Jones, Minister of Health, Scott Butler, Executive Director, Good Roads, and Thomas Backer Akat, Manager, Public Policy and Government Relations, Good Roads. Further, that this resolution be circulated to all municipalities in Ontario requesting their support.
Okay, so moved by Councillor Fisher, second by Councillor Tuyu. Yeah, this is just us supporting it. It was circulated by AMO, and there's no harm. I'm looking over there to the local municipality, no extra cost to us. So any other questions on the motion? Councillor Tuyu.
There was just a very tiny typo, but you read it, so it clearly
Kinga?
was intended, the Kinga with the A, yeah.
Okay, all in favor? That is carried. Thank you. Ramara Trail Opening Mayor's Walk. Madam Clerk,
The council
I gotta check
received
that
report ID 1725 as information, and that council provide parking exemptions on the south side of Airport Road, east side of Ramara Road for the duration of the event.
Hopefully I can make that. I've also got the Barry Air Show. Well, actually, I don't think I do have the Barry Air Show. So yeah, Councillor Goff. All right, you'll move the motion, second by Councillor Tuyu, and I will get it in my calendar. All in favor? That is carried.
What's the date?
June 7th. That's what I was looking up here. So. Okay. Next, I have Fire and Rescue Services stats.
That we receive report FD 0125, Ramara Fire and Rescue Services 2024 statistics on call for service and call statistics for ice storm 2025 as information.
Okay, moved by Deputy Mayor, second by Councillor Tuyu. Question, Tony. So the ones for the ice storm, are we going to kind of keep a separate bill for that? So when we apply for funding, is it applicable?
Absolutely. To your worship, the treasurer has set up a GL specific to the ice storm event, and any costs incurred that are reflective of that are captured there. And we have separated any calls that are reflective of the storm in that as well.
Yeah, there was a busy time.
It was.
Did I have a mover and a seconder? I believe I did.
Yes, your worship.
Any other comments from council members? All in favor? That is carried. Thank you. We are up to application for a subdivision.
The council received staff report BP 13/2025 entitled Application for Plan of Subdivision, file RAT 2201-4836 Muley Point Road, Highland Mills Development, Inc. Be received as information.
Moved by Councillor Goff, second by Councillor Fisher. Yeah, this is information. I guess the site plan approval doesn't even come to council anymore, does it, Jennifer?
Good morning. So the draft plan approval will come to council, and that will come in May, most likely, based on the timeline for processing that we're expecting. So it will come. This is more just an information to kind of give you a highlight of where we're at in terms of the subdivision, because there's no public meetings required for plans of subdivision anymore.
Right, and I know it's already zoned for it. I know there was a zoning amendment when we actually added to the natural area protection was part of it.
That's correct.
Yeah. So any other questions on the subdivision plan to receive? All in favor? That is carried. Thank you. Next, Muley Point Road, number 8. Oh, no, number 9, sorry. Yeah, 9.
That
Official plan.
That report BP 1125, overview of the Township of Ramara official plan 2025 be received as information.
Moved by the deputy mayor, second by Councillor Fisher. I got my booklet already. I see everybody else got theirs today. Any questions at this point? We'll review it. Not seeing any. All in favor? That is carried. Thank you. Oh, sorry, Wally. I'm up. Kind of skimmed over you there.
Yeah, I'm sitting in the corner. I didn't have a hand button to put up. We were hoping to have a short presentation to council and the public to provide information on the significance of the document, the work that we've done so far, and the next steps moving forward. If we could.
Oh, you have it? I didn't
Yes,
see it
yes,
on
we
the
do.
agenda.
Yep.
So yes, you're ready, Jen? We'll go ahead.
Number 10, your worship.
No, where you got it, the official plan here.
That report BP 1125 overview.
No.
I'm
We're doing a
sorry, wrong
presentation on the
Jen.
official plan. I didn't have it in my agenda, but they
Wrong
have a
Jen.
presentation for us. So, yeah. Go ahead. Oh, sorry, different Jen. Go ahead, Mr. Strong.
So.
Waleed's actually going to start.
Yep. No problem. So, yeah, just again, like we said, just a quick update on the official plan. We'll just give you a background. Municipalities are required to revise their official plan every 10 years and then update them every 5 years. So our timeline started in 2017 when we began to update our official plan. There were focus groups held, open houses, and public meetings. The updates were delayed due to the unforeseen circumstances of 2020. Through the years of 2020 to 2023, there were significant changes at the provincial level with planning policy and the Planning Act that essentially really changed how we do things. So the growth plan and the provincial policy statement were replaced with the provincial planning statement. In 2023, we revitalized the update to the official plan. We updated the text based on the expected and anticipated policy changes at the time as they were evolving quite rapidly. We held open houses, statutory and the statutory public meeting, and we presented a draft of this OP in 2024 before the planning statement was actually finalized. When the planning statement came into effect on October 20th of 2024, the draft was finalized and posted in December of 2024. So anything that was, that change that affected our original draft, we omitted or added to meet the requirements. In 2025, additional comments were received from agencies based on the December publication. They were from the school board, CN Rail, the Ministry of Environment, the County of Simcoe, and from the community. Staff reviewed the plan and the associated schedules with the County of Simcoe, and we refined them as required. In April of 2025, the final draft was ready for presentation. It got delayed just a little bit due to more unforeseen circumstances. Some minor edits were required for formatting, topographical errors that have been identified since it's been published. Some road names are to be updated, and the transportation schedule will be updated with the new road names before May of 2026. So the purpose of the presentation to council today is basically to review key policy changes as described in the staff report, provide a quick overview of the comments received in the drafting of the official plan, review the schedules, and just let you know about the adoption timeline. The policy updates, the aggregate policy primarily found between pages 56 and 135. The policies have been updated to ensure consistency with the PPS. A change from PPS 2020 to the 2024 version is the requirement of rehabilitation in agricultural lands. The substantial quantity and evaluation of other sites has since been removed in PPS 2024. So now complete rehabilitation to an agricultural condition is no longer required if the depth of the planned extraction makes restoration of the pre-existing agricultural capability unfeasible. So, and if you maintain maximize use of the agricultural lands on the lands themselves. Employment lands, there's now a definition for employment area, and an employment area means those areas designated in an official plan for clusters of businesses and economic activities, including manufacturing, research, and development. So when you look at the plan overall, you'd look at our industrial park and it would look like industrial lands, but it wouldn't meet the criteria. So there would be, it allows for additional uses. So we had to have more industrial lands available, which is good for kind of stimulating the economy of Ramara. Strategic growth areas. There's a new term now in PPS 2024, which means settlement areas, nodes, corridors, and other areas that have been identified by the municipalities to be the focus for accommodating intensification, higher intensity mixed uses, and more compact built form. So it's really looking again to intensify and make use of servicing and infrastructure that already exists. These areas have been identified in Brecon and Atherley along the main roads, downtown areas where servicing is available or planned. It also identifies some stable neighborhoods as an influential method to protect character and ensure growth and development is directed to planned areas. A large portion of Lagoon City has now been identified as a stable neighborhood. So you don't see any massive or impressive type buildings changing the character of that community. Both those areas are not land use designations, but they are included in the secondary plan and schedules. In 2024, the agricultural system, municipalities are directed to basically approach this based on a provincial guidance in geography identified. Start this over again. Based on provincial guidance to geography to identify continuous agricultural land uses. This overlay can now include land use designations that are not agricultural. The system helps to interconnect land use planning and economic development, supporting the agri-food network. So it's just seeing a slight evolution in the way we do agriculture to allow additional ag type uses on ag lands.
And if I may add to that, you will all remember how the province had those provincial agricultural systems mapping and the provincial natural heritage system mapping. So the new PPS rotates away from it coming from the province and more coming from the municipality, as they do know best to identify those areas with provincial guidance. So I am meeting with OMAFRA this week to go over the agricultural system mapping, but that's kind of the change. It's no longer coming from the top down. It is coming from the bottom up with influence.
That's the way it used to be.
Yeah, it should be. Yeah. So it's nice. A lot of the changes are really refreshing, and they make it more open and more workable for local communities. We got a lot of comments from circulation. I'll let Jen touch on the comments that we see from circulation.
Thank you. So yes, we did get pretty robust comments in from the community and from agencies, which was very much appreciated. There were a lot of perspectives and updates that that needed to be included. So we were really, really happy with the response that we got. I'm going to go over a few of them, just sort of a high level to highlight kind of what the concerns were and where we ended up after we received those concerns. So the school board, we had an ongoing conversation with the school board regarding the official plan. They wanted to ensure that there was consideration for hooking up schools to municipal and community water and sewer infrastructure when it became available. Most of our rural schools are on septic systems, obviously, and they are pretty much at capacity. So to be able to get into those systems is very important for their expansion, especially with new developments close by. They were also looking for us to add information about being able to have the schools in the settlement area no matter what the zoning was. So in our official plan, you have your village settlement areas, which allow for village institutional, village industrial, village commercial, and village residential uses. The school wanted to ensure that schools could go in any use, which they can, because it is a permitted use. So we did do slight language changes there just to make it very clear for them that if a school needed to establish in a village residential area, that would be totally acceptable, which it definitely is. We do have a village institutional area in Atherley that's really planned for a school site, but if for some reason that doesn't work, we can be flexible with the location. They also asked us to review, we had received a request from a property in Atherley that was looking to establish a village commercial area on their property. And the school board had concerns with changing that to village commercial, that it would disconnect the community and stop the complete community within the 15-minute walk. So we have reverted that property back to, it used to be future growth area. The terms change all the time based on the provincial policy, but it is set up for future growth so that there's really no actual definite designation for that, but then it will be reviewed when the time comes and the property is ready to be developed. We did receive a response from the school board that they were very pleased and satisfied with all of their concerns. We did receive some comments from the Ministry of Environment, mostly relating to some of the secondary plan provisions in the Atherley-Updegrove area. So what happened was the Atherley-Updegrove secondary plan was sort of merged into the new official plan. So some of the language in that plan didn't speak necessarily to the no sewage systems within the Lake Simcoe Protection Plan. So we made sure to have that information in there for them. So that's updated in both the servicing feasibility and the Atherley-Updegrove secondary plan area. MHBC submitted multiple comments, mostly regarding aggregate policies. Some were generic aggregate policy concerns they had, and others were site-specific for their individual properties that they represent. For the most part, the comments they had were due to the outdated policies that were in there previously. We have updated the aggregate policies. They are robust and they are current. And so some of the responses we just provided back stating that the statement would stay in as a policy because we felt that it was important. The one thing we did add was transition policies in the official plan. So they basically, I just have a few notes for that. They basically identify that if an application is deemed complete before the new official plan is in effect, that it amends the new official plan and then also is respectful of the existing official plan at the time of application, while encouraging them, obviously, to update it if there's any changes that need to be made for the new OP. And it's just sort of a protection to make sure that when we are changing our policy, that everything goes across. With the PPS, when that was put in, any applications had to resubmit a planning justification report to say how it met the new PPS. That doesn't generally happen with official plans. So putting in this transition policy just provides us with clarity for the applicants, but then also provides the municipality with sort of a, no, your application wasn't deemed complete even though it was in, so you have to update. So it does have to be deemed complete by staff. Woodbull LLP put in some comments about Dalrymple lands on behalf of LCP, which is like the old Talisker development. So they have a piece of property that's to the west of Lake Dalrymple that is under appeal right now at the county official plan on the Greenlands designation. Previously, our official plan, because it was from 2003, allowed for multiple lot creation in rural areas with the rural subdivisions. So that kind of went by the wayside with the growth plan, but now it's kind of back as long as you can demonstrate that it's fiscally and feasible and responsible from an economic perspective. So their comments were addressed by updating the lot creation policies to be reflective of the new PPS. We did receive comments of concern from residents who were concerned about their properties going from rural to green lands, and this is a very common concern. The update from rural to green lands is a conformity exercise. So if the property is designated rural in our current official plan, but it's green lands in the county official plan, it's getting updated to green lands as a conformity piece. The county is working with a consulting firm, I forget what their name is, to look at the Greenland system. They're actually going to be refining the Greenlands area. We have seen some mapping to that effect as well. So that is going to go out to the public, and we will make sure to push that out on all of our channels, because it will be an opportunity for those that do have the Greenlands that they think is, you know, improperly designated on their property, to put in those concerns to the county. So once that's done, we'll have to do an update to ours and a conformity exercise. But the Greenlands itself, like the existing uses in the zoning are pretty protected. You know, like if you have an agricultural property and it's getting changed to Greenlands, you are able to continue that agricultural use. Things that are restricted are large commercial uses or lot creation. And it's not that it's a no way, you can't do it. In some cases, you can refine the boundaries of the Greenlands through an environmental study to demonstrate that it's been improperly designated. The county is using sort of new LIDAR and all types of new technologies to kind of differentiate. They say the new system can tell the difference between, you know, a cedar bush that's 2 feet high versus a maple forest, and they can actually see now based on the elevations if they are putting things properly. But we will definitely be making sure that we get that information out there so that we can get some of that ground truthing done on some of these properties. We did receive some comments too from Noah Stegman, up more centered around kind of the Lake St. John type area. He had questions about properties that were identified in the Lake St. John watershed that were designated shoreline residential, and he had felt that they should be designated greenland. So the township owned ones they're those lots that are on Bluebird but across from the lake. Those kind of rectangular ones. People have asked to purchase them in the past, and they're all in a floodplain. So we have redesignated those ones to greenlands. There are some lots in the Lake St. John area and in other areas that are designated as shoreline residential. And they're designated greenlands by the county. And so, like I said, with the rural, it goes from rural to greenlands. But with shoreline residential, when we spoke to the county, we felt that it was important to still maintain that shoreline residential designation, because we didn't want to change every property to greenlands, because there's specific policies in the shoreline residential area that are important to those communities. Think of Joyland Beach and, you know, things like that, where they have their community areas. If you change it to greenlands, it can kind of impact how we direct those permitted uses in that shoreline residential area. Still restricting lot creation for sure, but it's not going to stop people necessarily from being able to kind of continue to revitalize those types of neighborhoods. He also had questions about a private waste disposal facility up at Stepan. So we have confirmed the location of that with the county as well. Jerry Stegman had put in comments regarding including information about modes of transportation, trails, bikeways, those types of things. So the official plan document is really supportive of micromobility and different types of transportation, active and vehicular, obviously, and the coordination of the two and the harmony of the two. We also have references to the recreation master plan, which in the official plan, so that we are, you know, checking to make sure and making sure that we're directing developers to go look at that plan to see what the plans are for the community so they can integrate those into their planning applications. Conrad Brenner submitted comments as well, and if Conrad Brenner is listening, I apologize. His name is Connor in the in the response matrix a couple of times, and it's on my list of things to fix, but we just didn't get it fixed. So definitely Conrad. He had some concerns about the servicing policies. We have updated the servicing policies. They used to really more support allowing for kind of these smaller individual systems, which we don't necessarily want to say, yes, we want all these small systems. So it's really going back to that provincial hierarchy and then requiring that feasibility to show that if somebody does want to put in a communal system, that it is feasible. The municipality will be able to take care of it when it's done so that we're not in situations where we can't afford the infrastructure that's being installed. He also, Aaron Little also had questioned about the redesignating from his lots on Louis Lane from rural to Greenlands. He had a site-specific policy to allow for that lot creation to happen back in, I think, 2008, roughly. So we have redesignated the lots Greenlands because the lot creation has been done, and Greenlands does allow for single-family dwellings on lots where the zoning permits. Steve Percy had questions about future growth areas in the secondary plan for Atherley. This is the word, it's future development area, because I guess growth area or future growth area used to be a growth plan reference, so we had to update it to future development area. Same with strategic growth areas are now some other term because they do have to change based on provincial policy. So he was wondering about, sort of the point of these future development areas. And the future development areas are kind of areas that we don't foresee them necessarily getting developed within the next 5 to 10 years because we're expecting it's going to go where the servicing is going to go. That's not to say these areas can't be developed. We would just require like a growth management study or a plan just to show that we're not sterilizing future development by going in that direction or making something unfeasible. So lastly, we're going to go over the schedules. Does anyone have any questions about that before I get into the schedules?
Deputy Mayor, I just had one. You quickly went over something about a private waste facility at the old Steppen plant.
Yes, I will get to that. I can
Okay,
show you on the schedule. Yeah, it is on the schedule. Okay, so just bear with me, please, while I get the schedules up. And I will keep this relatively quick because you have seen them before. But I do think it's important just to kind of go through them on a very high level and just tell you sort of what the purpose is and why we use them. Okay, so the first schedule, which these are all in your binders at the back on the 11 by 17, and they are available on the website as well because they can be kind of hard to see if you don't zoom right in. So this is Schedule A1. This is our land use schedule. So this schedule, as soon as we get an application and we go and we take a look to see where this property falls within the land use designations, it allows us to make sure that what is being proposed is actually permitted, and then also kind of an overarching, what is the area, what is the intention for this area, right? In each land use designation, you kind of have a goal of that type of designation. So we want to make sure whatever's happening on a property meets the overall goals and objectives of the official plan and the specific area where it is designated from a land use perspective. I have them all open, so I will try to. They were in order. Oh no. Okay, so that was A1. So let's close that one. My apologies. I had these opened in exact order so that I wouldn't run into this. I'm just going to stop sharing so I can pull it up individually. Okay, here we go. This is the one that's difficult to load. Okay, so the next schedule is A2. A2 is our natural heritage schedule. It has a lot of colors on it and is quite busy. It identifies both the evaluated and the unevaluated wetlands by the MNR. It also identifies the areas of natural and scientific interest, which we do have one, which incidentally is the down in Bayshore. We have the woodlands area that again is mapped by the MNRF, and it identifies woodlands that we may need to investigate for significance. And then it also has the Lake Simcoe Protection Act boundary watershed on it, because some of the policies in the Lake Simcoe Protection Plan for natural heritage features are different than outside of the Lake Simcoe Protection Plan, so it's important to have this one on this one. So the purpose of this schedule is to identify any natural heritage features during the review of planning applications, which guides us to highlight which studies will be required, and will also help us protect and confirm the type and limit of the natural heritage features. Schedule A3 is our floodplain areas. So we have 3 mapped floodplains within the township, and if we end up getting more mapped floodplains, we will add them to this schedule. There's the Lake Simcoe, the Lake St. John, and the Black River floodplains are all on this schedule. And the reason we have that on there is because when a planning application comes in, we need to make sure that the natural hazard policies are addressed in the PPS. Moving on to the secondary plans. So B1 is the secondary plan for Atherley Uptergrove. So it shows the intended uses. So like I said, in a village settlement area, all of the uses are permitted in the village institutional, residential, commercial, industrial. However, the secondary plan sort of guides where we're expecting concentrations and pockets of those uses to be. You can also see on this area here, I'm not sure if you can really see in the cursor because it's kind of bright in here, but this is where we have our strategic growth area sort of hatched out to show, because the idea is that the servicing would come into here, so we would sort of concentrate our growth here and then move out. These kind of more beige areas, these are these future development areas that don't really have any specific designation yet because they may change depending on how the area develops. Go to B2. Here we go. So B2 is Brecken. So in here you can see we have the strategic growth area highlighted mostly in the lands in between Lagoon City and Brecken that are now added to the Brecken settlement area, and then kind of along the main highway there. Those are mostly village residential. You have the commercial down where the existing commercial is, and then we have our Ramara Industrial Park here. And this darker section is these new employment lands that we're adding. So the employment lands are protected in terms of keeping sensitive land uses away and really putting that kind of manufacturing sort of hard industrial research industrial type of thing. You wouldn't have, like, you know, when you go to a business park in Barrie or even in Aurelia where they have the gyms and everything kind of all mixed in with that. That doesn't happen in employment lands. Stuff like that can happen, you know, in the industrial park, but not in the employment lands. So in those employment land policies, the PPS also speaks to sort of having transition lands that have compatible uses within the settlement areas between your heavier industrial uses and your sensitive land uses. So the idea here is that the Ramara Industrial Park will kind of serve that need, right? It's sort of that niche in between community service and industrial. So that was sort of the premise for setting that up. B3 is Lagoon City. So you can see that dark hashed area. That's our stable neighborhood that we've identified in Lagoon City, sort of in that core where you have all your single family dwellings. And then outside of that can intensify, obviously subject to provincial policy and approval. But that sort of holds that stable neighborhood just to stop anything that kind of disconnected sort of growth where you have a condo in the middle of the Lagoon City Canal. That wouldn't be ideal. So this just sort of identifies that area as a hold with gentle intensification. Schedule B4 is the Ramara Road corridor. This is essentially unchanged from the current Ramara Road corridor development. You sort of have your protected areas, you have your main intersections that are identified, your existing built up areas and your destination commercial areas. Okay, I'm gonna read my notes here. Okay, moving on to Schedule C. So Schedule C is our highly vulnerable aquifer schedule. So it has our highly vulnerable aquifers, significant ground recharge areas, wellhead protection areas, intake protection zones, and again, also has that conservation authority boundary on it. So the purpose of this schedule is to protect our ground and drinking water. So we'll check to make sure, depending on where they land within this, additional studies may be required based on different policies, such as like the Clean Water Act and the Lake Simcoe Protection Plan. Okay. Schedule D, which can be, I don't have open, but Schedule D, which you will see in your official plans, is our high potential mineral aggregate schedule. It is essentially unchanged as well from the one that we have. And it's all based on the Ministry of Natural Resources and the County of Simcoe. So there was an OMB approval for those areas. So they've all been transferred over in just as they are now. And the purpose of that schedule is to protect those aggregate areas, because if you're identified as high potential, we do need to not stop, but we need to review, almost stop. We need to review the development that's in those areas to make sure that it's not impacting the availability of aggregate in the future. And then also we need to identify existing high potential mineral aggregate operations so that if there is development, we can ensure that there's land use compatibility. Schedule E is the landfill activity. So this has the private and the public, like the county, active and closed landfill sites. So down in here in Longford Mills, right in this area here, there's a private waste disposal site there. I forget what the site number is, but there's an old dump there. So then any development that's within these kind of gray areas usually is required a D4 study, which just checks the land to make sure if there is development that there's been no contamination in the land. And when I was speaking to the county specifically for the Mara transfer station, because you'll see that this buffer area is a little bit different than most. I guess as an active landfill site, it's from where the actual landfill is. So that's why you sort of see that buffer area more on the north side of the property. Okay. And Schedule F is our transportation schedule. So it has all of our roads on there, our unopened, our opened, collector, local, future. All of the roads are all identified on here. And as Waleed had alluded to with the road name change, I just have to go in and change a few of the road names, but it's pretty much done as well. And the other schedule is the agricultural systems mapping, which basically kind of colors around the outside of the agricultural land. Any questions on the schedules?
Yes, Councillor Tuyu.
Thank you. Just looking at Schedule D for the high priority mineral aggregate resources areas, I'm just noticing that the Fowler Fleming quarry there at the corner of Rama and Switch Road is now shaded as an HP Mara site. Was that a designation given by virtue of them receiving their license, or did some other?
It should be shaded as an active aggregate. Let me just take a look.
Just because in the 2003 it was not listed as a high priority, so.
I believe that one's actually mineral aggregate extraction because there's an active quarry on it right now.
Okay, but it's not considered high priority. Sorry, that's,
yeah.
I was trying to read the legend. And
yeah, no, that's small. Okay. So it's high potential mineral aggregate extraction is where there may be, or they expect there's going to be resources underground, whereas the mineral aggregate extraction designation shows where there is an active quarry. So that is shaded with an active quarry, not high potential. And so that's reflective of the existing license.
Got it. Thank you. I was looking at the actual name of the schedule itself and assumed it was that.
No, that's okay. Okay, perfect. So in terms of, was there
Do you follow up? Yep.
On a different schedule, can I ask another question? On, I guess, the natural heritage schedule, I forget which one it was.
A2.
Yeah, and I only wanted to ask about it. I would have brought it up before, but when I attended the Couchiching Conservancy Agency, or AGM, a couple of weeks ago, they were talking about ecological wildlife corridors, and I'm just wondering if they've been factored in at all to our official plan.
So most of the time, the wildlife are not actually mapped out because of all the different changes, like with species at risk and all those things. So it doesn't really get mapped out because I guess they can technically be anywhere. So when you do your species at risk assessment, it would look into that. But I can put a note and just see and ask about, so it's the actual corridors themselves, right? Like the traveling corridors?
Yes, because I do notice that within Parks Canada, they have our whole area, Simcoe County pretty much is highlighted in green as one that they provide for ecological corridors. And I know that for the Williams Street East First Nation, they automatically have their own corridors factored in as well. But when I spoke to their representative at that AGM, he was saying the problem is that municipalities don't necessarily have that provision. And wouldn't it be neat if we could all get on the same page?
Sure, I can definitely look into it.
Thanks.
Great, perfect. Okay, so just to summarize, I'm done going through all the schedules. So right now we are working just to finalize any italicized terms that need to be done for legal reasons and definitions and those types of things. Fixing up a few typographical errors, looking into ecological corridors. And so on May 26th, we're going to have a policy report ready for council's review that sort of reviews the entire official plan and talks about how it's consistent with and or conforms with all of the upper tier and upper level policies. You can ask questions and everything at that point as well. And then on June 2nd, the official plan will be sent back to council again for adoption, with the hopes that it would be adopted. Once it's adopted, then we have to gather all of the information and send it off to the County of Simcoe, as they are the approval authority for the official plan. And for your benefit, we have been working very closely with the county regarding the official plan, and we've had working drafts with them and lots of conversations. So I don't expect many, if any, revisions, to be honest. They are basically ready for us to send it to them once it's adopted. So.
Perfect. Any other questions? What year is the one we're operating under now?
2003.
That's what I thought, 2003. It's been, oh, listen, and I hope this one doesn't sit at the province for 9 years like the last one did before it got approved.
I don't think it will.
And actually, many of the municipalities are bringing theirs forward now. They're all in the same boat as us. It was just such a moving bar. Every time you wanted to start it, natural heritage came along. Then there was always, the target just kept moving. And finally, we got a little bit of continuity that we can actually build a plan and get it approved. So any other comments? So just, we already had a mover and a seconder to receive. All in favor? That is carried. Thank you. Yes. I've got one more item and then we're gonna head out and back into council. So can I finish number 10, I think? Oh, maybe not. You want to take, maybe better, that one might take a bit of discussion. Why don't we take 10 minutes and then come back? All right. Okay, I believe I'm up to item 10, but there's two planning applications under item 10, Madam Clerk. So I guess we'll deal with the first one first.
That report BP 1225 recommendation report, official plan amendment and zoning bylaw amendment files OP-424 and Z-524 3819 McCray Park Road, 957-5464 Canada Inc. be received. And that files OP-424 and Z-524 3819 McCray Park Road, 957-5464 Canada Inc. be approved.
Okay, moved by Councillor Fisher, second by the Deputy Mayor. I think, Jen, you had some comments, Mrs. Strong, on this application.
Yes, certainly. So this was the official plan and zoning bylaw amendment application for the corner of Muley Point and McCray Park Road. It's 3819 McCray Park Road. This is the application for the outdoor storage establishment for recreational vehicles. We had a public meeting in December for this proposal, and at the time there were concerns about the requests for reduced setbacks due to site triangles and character of the neighborhood, storm water, snow storage, things along those lines. So the application has been amended. The site plan has been refined, which we will go through that. And they have also updated their planning justification report to meet provincial policy to demonstrate that there's no other sites that this could be in, both zoned appropriately and within an agricultural system. So this is the original site plan. Again, I'm sorry, it's kind of bright in here today, so it's hard to see it on the screen. But the original site plan asked for a 5-meter setback from both roads, where the zoning bylaw requires a 10-meter setback. The original site plan also asked for a 2-meter setback from both neighboring property lines on the rear and interior side yard, where the zoning bylaw requires a 10-meter to the rear yard and a 5-meter to the interior side yard. They were also looking for 33 vehicles. So they have refined the site concept. I'm just going to put it up on the screen now. So as you can see, they are meeting most of the setbacks. Because this is a corner lot, it is not uncommon to have reductions in rear yards because it's almost like they have 2 interior side yards and 2 front yards. So this rear yard back here on the west side of the property is supposed to be 10 meters, and they've asked for 5 meters, which reflects what's required in an interior side yard, which we have deemed acceptable. Yeah. They've also reduced the number of parking spaces to 30. They have created a snow storage area that is away from the actual roadways themselves. And they have increased the setback for the recreational vehicles to the 10 meters, which is what's required under the zoning bylaw right now. They also have a 10-meter site triangle proposed on the northeast corner of the property. Right now, the zoning bylaw requires a 3-meter setback. However, under the Municipal Act, the Director of Infrastructure at the time requested a 10-meter setback for the site triangle to ensure that there is no impeding of site views on that side. Some members of council, and I know the planning department, did receive an email last night with concerns about the proposal due to the site triangle specifically. The site triangle will be verified at site plan approval. This isn't the last step for this property. This is for the land use to allow for the 30 spaces with the required setbacks of 10 meters and 5 meters, and allowing for the maximum of 30 vehicles to be stored on site. That site triangle, drainage, landscaping, all of that will be reviewed through site plan approval. So while council is no longer the approval authority for site plans because you've delegated it to staff, we will ensure that those are met. Just to obviously to make sure that the site functions properly. So that site triangle specifically will be reviewed to make sure that the 10 meters is enough. And if it's not and has to go back a bit, then so be it, it will, right? So they can't impede the ability to see and obstruct views on site triangles. The 10 meter, we'll review it closer at that standpoint, but the 10 meters that they've proposed is what's requested so far. Yeah, and I think that's basically, I'm just trying to think if there was anything else I wanted to highlight to you. They will have to do buffer strips sort of along against the residential properties, just so that they're not just looking at vehicles, and everything will be reviewed, and a surveyor will confirm that everything's in the right spot. Oh, that was what it was. I'm sorry. So Councillor Snutch had asked during the public meeting about the ability to regulate the height of a trailer. And so we can't regulate the height of a trailer, but we did ensure that the definition for recreational vehicle in the amendment is very specific, because there was concerns about the ability to kind of stack vehicles on a trailer or something along those lines, like how many vehicles are you going to put in? So under the definition, the one space is however many trailers are on a vehicle. So if you have sort of one of those side by side where you can put two Sea-Doos or two Skidoos, that kind of thing, we can put them on one trailer, then that's considered one recreational vehicle. They won't be sort of stacking 6 trailers with individual vehicles on them.
Yeah, I think my concern would have been in the larger car transportation where they double stack them. That's what I think was referred to.
Yeah. So the recommended motion is to approve the applications as amended. If that's approved, then the amendments will be finalized and they'll be returned to the next council meeting.
Yeah, I like that we held firm on the 10 meters. That was my concern on the sight lines from both those major artery roads. So any other comments? Councillor Goff?
So just to be clear, the fence that's there, which is a square fence, is going to be a triangle. That corner is going to be moved at the corner. Really point to.
That's correct. Yes, a 10-meter site triangle. So, and this is measured from the road allowance as it touches the property. So it's not the center of the road back 10 meters. It's where the road allowance touches the property. It will be 10 meters back on each side and then cut across to create a site triangle.
But the remainder of the fence will be on the property line, which it corresponds with the fencing act. You're allowed to fence your property.
That's correct. And we will confirm through the survey that that fence is in fact on the property line.
Perfect. Any other questions? Councillor Fisher?
Thank you. I know there's chain link fence right there, which means that you see what's happening on the property. But moving forward with the concern of sight lines is having a vinyl fence would be able to hide from view, but would also obstruct view, like as you're driving down the road towards the stop sign. Is there controls in site plan approval that makes the material of the fence have to be one way or another, or is that beyond our mechanism?
So
go to Jen. Yeah.
Yeah. So I'm not sure that we can actually regulate the material and the type of fence.
No.
However, under the Municipal Act, the municipality does have the right to have things removed that obstruct view. So if the fence became a sort of a board fence that might impact the site triangle, it would be dealt with at that point. They don't need a permit for a fence. So, it might be chain link now, but then they may change it to vinyl later. But if it is obstructing the view, I'm almost positive, and anybody can correct me if I'm wrong, but under the Municipal Act, we can remove things that are obstructing view, or obviously ask them to remove them. So if it ended up getting filled with things that you couldn't see through and it was obstructing, then it would be dealt with at that point.
Yep.
So then would the same hold true for the area that they've created right now where it says landscaped open space? I know we had talked about it and it might be nice to have it beautifully landscaped, maybe some shrubbery, low shrubbery or whatever, but should it turn into like grassy meadows, other than property standards, of course, because they could be decorative grassy meadows too. Is that the same idea? That if it's obstructing view, even though it now is fully within their fence and fully on their property line, like within their property?
Yes, actually, the Municipal Act explicitly includes trees and shrubbery in the things that the municipality can have removed.
Okay, Councillor Tuyu.
Thank you. There's 2 entrances on both roads, on Muley Point Road and on McCrae Road. And I know that at that intersection, there's only a 2-way stop on McCrae. There's no stop sign at Muley Point, right?
That's correct.
Yes.
Yeah, the McCrae is the stop.
Right. And I know from, having heard from some of my residents who deal with, confusing 2-way stop issues at Cortland and Balsam, that sometimes, especially in an area where tourists might be going, especially to the park, sometimes when people see a stop sign, they assume that it's 4-way and it's not. And I'm just wondering, would it make sense to turn that into a 4-way stop to make it more safe? And if not, would it make sense to put two-way tabs on the McRae Park roadside so that they would know that the other side does not have a stop sign?
I may defer that.
That might
to
be
the
an Andrew
infrastructure.
question or Laura. I would be more confused if you put a tab because that's what you look for. You see a stop sign, it's stop. If you see the little square four-way underneath it, I'd be afraid people wouldn't read it. They'd see that and then make the assumption it's a four-way. That would be my concern. Down the road, we may want to add a flashing one because I know there is a lot of tourists come out of Joyland Beach and tend to kind of blow through that when they're pulling their trailers, right?
Yeah, thank you. Through you, your worship. We'll review that. That's a very good comment and a good thought. So we'll work with our planning group to take a look at that.
All right. Any other comments? Not seeing any. So all in favor? I believe I had a mover and a seconder. All in favor? That is carried. Now we're on to the second one, Madam Clerk.
Yes, your worship. It's actually, if I'm, correct me if I'm wrong, Jen, we're moving on to Simcoe Road.
Yes.
Okay. That report titled Recommendation Report Zoning Bylaw Amendment File Z-12599 Simcoe Road, 2490288 Ontario Inc. be received, and that zoning bylaw amendment Z-1/25 be approved, and the draft zoning bylaw attached as Appendix A be brought forward to the council meeting following this committee of the whole meeting to be enacted.
Okay, moved by Councillor Fisher, second by the deputy mayor. Any update? Keep in mind on this file, what we're actually approving is three houses. I forget what they call a row house of three houses. If they're allowed to add more, that's under the Planning Act and not within our authority. It's three residential units we're allowing in this property. So any other questions or concerns? All in favor? Opposed of any? Not seeing any. Thank you. I think we're ready to rise. Do you need time before we go to council,
Your
or do you have
worship,
all
I'm
the
ready.
motions? We can just go right through them, can we?
No, I have a resolution ready to go, your worship.
Okay, perfect.
That the recommendations of the committee of the whole be referred to the next regular meeting of council to be held Monday, May 12th, with the exception of the following items, which shall be referred to the consent agenda later today. Exception item 10.1, exception item 10.2, 10.3, 10.4, 11.1, 11.4, 11.5. And that committee of the whole rise and the meeting of council reconvene at 1:00 PM.
Okay, moved by Councillor Fisher, second by the deputy mayor. All in favor? That is carried. So we are now back in council.
Yes, your worship.
All right, so reports from the current April 28th, 2025 committee of the whole session. So these are the ones that we passed that we are ratifying now. So you have
Exactly.
the individual motions for me?
Yes, that committee of the whole report dated April 18, containing items 10.1, 10.2, 10.3, 10.4, 11.1, 11.4, and 11.5 be adopted as presented.
I did have a request for a recorded vote on item 10.2. The request was still made, so I would honor the request. So can we pull 10.2 and we'll have a
Yes.
recorded vote on that particular one? The councillor did ask for it, so I will do that. Yeah. So on the others, can I have a mover? Move Councillor Goff, second by Councillor Fisher. Questions or comments on the rest of those items? All in favor? That is carried. So now 10.2. And I guess all requests a recorded vote, so.
Deputy Mayor, Mayor Clark, you're requesting a recorded vote?
Yes, it was, Councillor Goff will request it, he said, because it was asked for by one of our councillors. Unfortunately, had to go.
Okay, Councillor Goff has requested a recorded vote on item 10.2. Would you like me to read the motion, your worship?
Yes, please.
That Councillor Bell be removed as a councillor appointed representative to the Lagoon City Parks and Waterways Commission effective immediately, and that Mayor Clark be appointed to serve as council representative to Lagoon City Parks and Waterways Commission for the remainder of the council term. And that Councillor Bell be removed as Liaison of Protective Services and that Deputy Mayor Bell be appointed as Liaison of Protective Services.
Okay, so that is moved by,
Councillor Goff has requested the.
yes, moved by Counselor Goff, second by Counselor Snutch, and now it recorded vote.
Councillor Goff,
In favor.
Councillor Snutch,
In favor.
Councillor Tuyu,
In favor.
Councillor Bell is absent. Deputy Mayor Bell,
In favor.
Mayor Clark,
In favor?
Councillor Fisher,
In favor.
all in favor, carried, your worship.
Thank you. So next I have, okay, where are we now?
Next
Consent
is the
agenda.
consent
item. So
agenda
we
with-
have one.
With one item, and with your permission, I'll just read that item, your worship.
Yes.
That council receive and support the Township of Georgina correspondence dated April 7th, 2025 as presented.
Can I have a moved by Counselor Tuyu, second by Counselor Fisher? Any discussion needed? Not seeing any. All in favor? That is carried. Not seeing any opposed. Postponed motions, we have none. Planning motions, none. Deputation
We
motions,
have
none.
one deputation
Is there-
motion.
Oh, yes, deputation motions. You're right.
And
That's
it's
our new,
the deputation by our Integrity Commissioner, Tony Fleming, that the deputation by Tony Fleming regarding the 2024 Annual Integrity Commissioner Report be received as information.
moved by Counselor Goff, second by Counselor Fisher. All in favor? That is carried. Yeah, now we have the one for the, yeah, I know we accidentally passed one, but we'll do it now when we're supposed to, which was the motion for the Kuchiching. We haven't passed a motion on it yet.
We did earlier, your worship.
Oh, did we?
Yes.
Were we? Yeah, we were in council. at the
Yeah.
time, yeah. So, perfect. Okay, notices of motion, I have none. Council motions previously given, I have none. So the inquiritory motions, I have none. So just the bylaws now.
Okay, that bill number 2025-19 and 2025-20 be read a first, second, and third time and finally passed as bylaws.
Can I get a mover to put them on the floor? Counselor Fisher, then the deputy mayor. I think one was the fees. Or no, they're all straightforward. Yep.
Yeah.
All in favor? That is carried. Fees and charges and the simple rule bylaw. Yes, so now confirmatory bylaw. That the bylaw 2025-28, a bylaw to confirm the proceedings of the council meeting held on the 28th day of April 2025 be considered read a first, second, and third time and finally passed. Moved by Counselor Goff, second by Counselor Tuyu. All in favor? That is carried, and we now adjourn at 1:03 PM. Moved by Counselor Fisher, second by the deputy mayor. And that is carried. Thank you, everyone.